Hi, my name is Sharifa. I'm a pharmacist. I'm going to show you how to use an insulin pen. Getting your insulin pen technique right is important as it helps to manage your symptoms better. It may take a few tries to feel comfortable using your insulin pen, but it does get easier with practice. There are many types of insulins available in the market. Please do check the instructions as well as watching this video. First, make sure to place all the proper supplies on a flat surface. This includes your insulin pen, your pen needles, an alcohol swab, and a sharp container. If you do not have a sharp container, you can use a heavy plastic container such as an old laundry detergent bottle. Before injecting yourself, wash your hands with soap and water. When your hands are dry, pull off the pen cap from the insulin pen and set it aside. Next, inspect the insulin through the viewing window. Do not use the insulin if you notice a change in color or if you notice things floating in the insulin. By inspecting the insulin pen, you'll also be double-checking that you have the correct type of insulin. Different type of insulin has different color, so it is important for you to know the correct one that has been prescribed by your doctor. After inspecting the insulin pen, put it down and open an alcohol swab. Wipe the rubber stopper on the end of the insulin pen with the swab. Allow the rubber stopper to air dry completely. Next, pick up the pen needle and remove the protective paper covering. Carefully screw the pen needle onto the insulin pen. Make sure the pen needle is screwed on straight and hand tightened. Next, pull off the clear plastic outer needle cap. You will see a second inner needle cap still covering the needle. Remove the inner plastic needle cap. The pen needs to be primed prior to each use. Doing so removes the air that is trapped in the needle. Turn the dial up to 2 units. Hold your insulin pen with the needle pointing straight up and lightly tap the insulin pen with your finger a few times. Next, press the push button all the way in. The dial should return to 0. You should see a drop of insulin appear at the tip of the pen needle. If the drop does not appear, repeat the process. Next, select your insulin dose. Turn the dial selector to the desired number of units. If your skin is not clean, use an alcohol swab to clean the site before injection. Insulin can be injected into either your abdomen or stomach area, buttocks, on the high hip upper outer area, thigh or upper arm. It is recommended that you rotate to different sides each time you use the insulin pen. In addition, stay around 2 inches away from your belly button, scars, or skin with open wounds. Insert the insulin pen into your skin straight in and not angled. Once the insulin pen needle is inserted into your skin, keep it in place and press the push button on the insulin pen all the way in and maintain it pressed until the arrow next to the dial returns to 0. Keep it pressed for a full 6 seconds after the dial is at 0 to make sure all the insulin is injected. Now, you can remove the insulin pen. Once the injection is completed, you can place the outer needle cap onto the pen needle. Use it to unscrew the needle from the pen and then replace the insulin cap on the pen. Discard the pen needle into the sharps container. Keep your insulin away from heat and light and please follow the recommended storage condition. For more tips on using other medical devices, why not watch our other videos?